Hi, everybody. Welcome. We have an amazing special guest today. Dr. Barry is joining us to answer, your guys' questions.
Absolutely.
Hi, Dr. Barry.
Hi, Amanda. It's such a pleasure to be with you.
Thank you so much for joining us. I truly appreciate it. And you are one of the other reasons that I have been able to stick to this. So thank you.
My pleasure. That's what I'm supposed to do, right?
So we'll just kind of jump right in. I have kind of aggregated the list of questions from everybody. And guys, just so you know, there were over 400 questions. I had to kind of combine a lot of them. We don't have infinite amount of time. So if I didn't get your question, I'm sorry, but I did the best we could. So, the first one is there a way to tighten loosening skin besides autophagy for those who can't do longer fasts? So people who are pregnant, trying to do ketovore and things like that.
Yes, it's called plastic surgery. There's really no other option. You can do it slowly through increasing your rate of autophagy. If you're pregnant right now, that's fine. Don't worry about that. You need to be focusing on eating preeminent nutrition to support your body and build a new human. After that baby gets here, then you can start doing some of the fasting that's required to increase the rate of autophagy. Now, there's a little bit of autophagy happening in your body all the time, even when you're eating, but the rate of autophagy goes up the longer that you don't eat. And we've seen people reduce and shrink an amazing amount of loose skin, redundant tissue. Pannus is the medical term on the belly. We've seen people who, you know how, Amanda, some people who are really, really large and they lose weight, they look great and they're so much healthier, but you can still tell by looking at them. They used to be really large, right? But with the power of autophagy and intermittent fasting, Nisha and I have met people on the road before who have lost 150 pounds. And intermittent fasting was a big part of the way they did that. And I'm like, you don't look like you just look like you've always been a skinny mini, in other words, right? But that only happens because when people have gastric bypass, you can tell, they've lost a bunch of weight, but you can tell they used to be big, right? And then people who do it with just calorie restriction and portion control, which is effectively just starving yourself until you're forced your body to lose weight, they don't ever look like they want to look. And so by implementing that intermittent fasting in with the very, very low carbohydrate diet, which is also, the ketogenic and the carnivore diets are fasting mimicking diets, right? So you get a lot of the benefits just from eating the food. But then when you also combine that with intermittent fasting, that's when you start to shrink the tissue. Now, it's not going to be fast. It's going to be slow. It's going to take months, if not a year or two. I hear Bonnie Blue. Do you hear Bonnie?
I do.
I should have sent her out to play like you did your two. And so it's not overnight. It's very, very slow process. It takes your body a long time to recycle all that unnecessary tissue. But it absolutely can happen to different degrees in different people. And so I encourage people, if they're more than 50 pounds overweight and they're afraid they're going to have some loose skin, take pictures every month or every 3 months. Get in your underwear and take a picture. Don't post it. Just save it on your phone, right? And because you won't be able to, because you live with yourself every day and you see yourself in the mirror every day, you're not going to notice the difference. But if you look at yourself now versus 3 months ago, you're going to be like, that looks better. And that'll give you that motivation you need to keep doing what you need to do. But at any point, you can always go see the plastic surgeon. They're happy to help you. And, that's going to be about 4 or 5 digits, depending on what all they do for you. But if you can't afford that, intermittent fasting is free.
Yes. I will say the 100 pounds I have lost, a little bit over 100 now. I am surprised at how little skin I have. Yep. But I also, for the past 4-ish months, have been doing OMAD. So I only eat every 24 hours or so. Perfect. I think that's had a huge impact because I was quite afraid that I was going to have a lot. Now, the last 100 pounds, I think, is going to be the real telltale, if I will. And you're right. If I have to have it, I have to have it. It's not the end of the world, I don't think.
because you're still going to be 1,000 times healthier, even if you have some redundant tissue. You know, that's the least of your worries.
Yeah. And I will say at one point in time, it was an unreasonable excuse, but I'm like, oh, well, I don't want to lose all the weight because of all this extra skin. But the thing is who cares? If you have it, it either will shrink or it won't, but you are not, or I was not remotely healthy. Who gives a crap about flappy skin?
Yep.
So the next one kind of follows along. Can carnivore help with lipidemia?
So yeah, both lipedema and lymphedema both respond to a meat-heavy keto diet, ketovore or carnivore. I was just part of a lipedema conference. It was a virtual conference a few months back with my good friend Siobhan Huggins and some other folks, and that is quickly becoming the standard of care. With anybody with lipedema, you need to be on as low of a carbohydrate diet as you can possibly get. And you and I both know that's carnivore, right? That's essentially zero carb. And there's a number of reasons why that helps. People with lipedema, they have an improper signal that's telling their body to store fat on certain parts of their body and not on other parts. Well, that signal is going to continue. And so they're always going to have some maldistribution of the fat. But if they lower their insulin level, which is one of the preeminent growth factors, right? It's one of the preeminent growth hormones is insulin. If it's chronically high, you're going to put on even more fat in those areas. If your levels of inflammation are chronically high, then you're going to have trouble with your lymphatic drainage. And that's going to keep even more volume in those areas where you don't want it. And so when you eat a diet that's both very, very low in carbohydrates and very uninflammatory, what you're going to notice is your lipedema is better than you ever dreamed it could be. Now, it may not be perfect because you still have that genetic variation that's telling your body to store more fat here than you really want to store there. But it's going to be so much better that I think the vast majority of lipedema sufferers won't care. They'll be like, boom, this is a home run. I'm happy with this.
I've never been diagnosed with lipidemia, but I can tell that it's probably a hereditary thing for me. My middle sister, I'm the youngest. My middle sister, if she gains any weight, it always goes to her arms. And I have a large amount of fat in my arms, even when I was thinner.
Yep.
I think I was like 180 pounds. 183 pounds is my lowest I've ever weighted as an adult. And I have an abnormal amount of weight in my upper arms. And my sister gets it too. So I do think it is. But I will say at 180 pounds, it was 90% better. So I do think personally losing the weight will help immensely with lipedema. Let's see. How does carnivore affect insulin and cortisol for those of us struggling with those things and hormones?
Yeah, so your insulin level is pretty much a high insulin level is dictated by the amount of carbohydrates you're eating. The only other thing that can give you high insulin, except your diet, is if you have something called an insulinoma, which is a tumor that secretes insulin inappropriately. Now, if you have that, you're going to have specific symptoms. You and your doctor will discover that. They will send you to a surgeon. They'll take that out and you'll be cured. But the vast majority of people, 99.9% of people with hyperinsulinemia, it's coming from their diet. They're eating too many carbohydrates for their personal physiology. And for some people, when they get the carbs down under 50 total grams, their insulin goes back to normal. Some people have to cut it down to 20, some to 10, some like you and me, we have to cut it down to 0, at least for now. Maybe not forever, but for now, it needs to be as close to 0 as possible. And that's going to move your insulin level back down into that low normal state where you can start to lose the weight and metabolize the stored fat. Cortisol, you hear a lot about that, and you're hearing more about that lately, that, a ketogenic diet raises your cortisol level. So first of all, cortisol does hundreds of things in your body. Hundreds of beneficial things. Cortisol is your friend. It is not your enemy. Your enemy, with regards to cortisol, is if it's inappropriately high at the wrong times for too long. And ketovore, carnivore, which are the proper human diet, they're not going to raise it to an unhealthy pathological level and keep it there. Anytime you fast, your cortisol goes up. If you get in a fight with your husband, your cortisol goes up. If you oversleep and you jump up and your cortisol goes up. That's just life. That's how we react to things, right? In the morning when you wake up, even without the alarm, the dawn effect makes your cortisol go up for a few minutes or an hour. That's totally normal. That's physiology. That's not bad. Keto kind of mimics that. Carnivore the same way. It mimics that temporary elevation in cortisol. It's not a bad thing, because what you're going to wind up with long-term, and that's our goal, is to have long-term health and happiness. What you're going to wind up with is a very optimal cortisol level long-term as you get healthier and healthier.
Isn't there an autoimmune, usually genetic, that you don't produce, the body doesn't produce any cortisol levels? And is it Graves? I can't remember.
Addison's. Yeah.
Addison's, yes. Because you get an Addison pump on the back of the neck. Now I remember.
Well, that's good. That's Cushing's. But yeah, it's an adrenal issue. That's exactly right. And it has a very specific set of symptoms. And it's not fun to have no cortisol. That is not fun. It's not healthy. It's bad.
A friend of mine, she has Addison's, and it's deadly. I mean, because her body produces none, and it causes a lot of issues not having any cortisol.
And she has to take exogenous cortisol or she would die.
Is the carnivore diet safe for someone with familial hypercholesterolemia who has high inflammation?
Yeah, it's going to actually lower your chronic inappropriate inflammation back down to baseline levels. Familial hypercholesterolemia is something you hear talked about a lot, almost as a fear factor for people who are doing keto or carnivore. It's like, oh no, you've got FH, you cannot do that. Well, that's ridiculous, but first of all, human beings have been eating high fat, high protein, low carb diets. Our ancestors have been eating that way for over 3.5 million years. And so if having FH was a terrible, terrible genetic defect, those people wouldn't have reproduced. They would have been weeded out, right, through evolution. Yeah. But they're still here, and there's a lot of them. So we know it must not be that big of a deal. What FH really does, and Dr. David Diamond talks about this brilliantly, it actually increases your blood clotting is what it does. It makes it much more likely for you to make inappropriate clots. It really has nothing to do with your cholesterol level or your LDL cholesterol level. That's not the dangerous thing about it. The dangerous thing is you become hypercoagulable, which means you're much more likely to form a clot. And that currently, that's not even being treated by the average doctor. All they want to focus on is getting you on a damn statin to lower your LDL cholesterol. They're not even considering the hypercoagulability, which is the true danger of familial hypercholesterolemia. So absolutely, you can eat a proper human diet with any medical condition, including FH.
Yeah. And correct me if I'm wrong, but with statins, the big danger with it is they're non-selective when they reduce the cholesterol anyway. So they not only reduce LDL, but they also reduce HDL. They just bring it down unselectively.
Sort of. Yeah. So even lipidologists now, Amanda, are starting to admit, finally, after we beat them for so long, they're starting to admit that normal LDL cholesterol is not dangerous, not bad. It's actually physiological. And we're like, yeah, duh. We've been telling you this for 10 years. What they're saying now is that, oh, it's oxidized LDL or it's glycated LDL, right? Well, the problem with statins is we need LDL cholesterol. It does hundreds of things in our body. It's very, very important. And so when your doctor wants to put you on a statin, or even worse, on Praluent or Repatha, the PCSK9 inhibitors, that's going to lower your LDL dramatically. But it's not just lowering the oxidized LDL and the glycated LDL, it's lowering all of them. So it's even lowering your good LDL in some cases down to under 50, which I think we'll see as years go by. That's very, very unhealthy. And I predict that Repatha and Praluent will be pulled off the market within the next 3 to 10 years. And there'll probably be lawsuits and all kinds of stuff about that, because that LDL is a very important structure in the human body. You cannot try to get it to zero. That'd be like trying to lower the oxygen level in your blood to zero, because if you have too much oxygen, that's bad for you. Well, yeah, but that doesn't mean you need to lower my oxygen to zero. And so that's the problem. They're non-selective. They lower all of it, the good and the bad. Now, if they could come up with a drug that just lowered oxidized LDL, I wouldn't have a problem with that, because it would leave the good, useful, helpful LDL alone. But my prediction here, first, going to be a world premiere prediction here on your YouTube channel. They'll never come up with a drug like that. It's going to be too complicated.
There's so many mechanisms that are unknown in the human body.
Yep.
So many.
That's a big deal.
Feeling with drugs is it's all an experiment. Even if they get them approved by FDA, they usually don't know until 5 or 10 years later. It's like, to me, the human body is like having millions of light switches. And when you turn one on or off, you have no idea how many others it's going to affect. So
well said. And so people may not know this. When a drug gets FDA approved, it's usually the FDA approved based on 1 or 2 short-term studies, a year, 2 years, 3 years. There is no long-term data. And so when people say, well, is Repatha and Praluent, are they safe long-term? The truthful, literal answer is nobody on the planet knows. You are the experiment. And so they will just prescribe this to millions of people, and they'll wait for people to have side effects, early death, cancer, whatever comes from it. And when they accumulate enough of that data, then all of a sudden the FDA will say, OMG, we need to pull that off the market. That's exactly what happened with Vioxx. There was no long-term studies proving safety. And so doctors would just anecdotally say, I started this guy on Vioxx and he had a heart attack 2 weeks later. That's weird. Then he would see it again and again and again. And finally they're like, are you guys seeing this too? And that's where it came from. And so anybody who starts a new drug that hasn't been on the market for at least 10 years, you are the lab rat, literally.
Yeah. What do you say to those people who are just obsessed with LDL? I see a cardiologist and he specializes in lipids. I don't think he's a lipidologist, but he was point blank. He's like, your LDL is going to go up. Don't worry about that. Let's do this advanced panel, see how your VLDL and everything's going.
Yep.
I mean, what do you suggest to those people who are just like, I can't do it because my LDL might go up?
Well, I think that's coming from a honest place, but also a place of ignorance. And I don't mean that derogatorily. That just means you don't know what you're talking about. And, human beings are not shy talking about things they don't know about. We're all good at that, right? Mm-hmm. And even doctors, they're really good at that. And so that's why many people find that their doctor becomes very uncomfortable very quickly if they start to print off studies from my YouTube videos about LDL and take that to their doctor and say, yeah, doc, but this study says. Doctors do not like that, because basically you're pulling back the curtain and there's the little wizard guy and he's just a dude. He's not magical. He's not special. And they don't appreciate that. But I think that's happening enough times across the country and across the world that doctors are really starting to pull back from being just, by God, you take the statin or get out of here. I think those days are quickly dying because so many people are calling their hand on it. Be like, that's still up for debate at best, and you're just wrong at worst. So if somebody is truly scared in their heart that their LDL might go up, I guess they can keep eating the standard American diet. I worry about their health, but if that's,
This is more like a personal question for when you were practicing, seeing patients in clinic. Did you ever feel like you got to the point where you were burnt out just because you'd have people come in, make complaints, not do what they needed to do, and then it's just like you just kind of got burnt out because you're telling them they're not following through?
Yeah, it was miserable, because every doctor goes to med school because they've got this dream of what being a doctor is. I'm going to save lives. I'm going to help people. I'm going to change their life. When in reality, especially in primary care, that happens maybe one time every 90 days that you're able to do something like that. 99.9% of the time, it's a drudge. It's drudgery. You're basically refilling prescriptions, yelling at them about the same lab results, telling them to join the gym and join Weight Watchers. And they're not doing it. But here's the thing, Amanda. They were doing it. And that's why I do what I do now, is because I realized I gave terrible nutrition advice the first few years of my career, and I harmed people with that. And so that's why I'm on YouTube Live all the time. And that's why I'm answering questions like this all the time, is to make up for that. This is my penance for being an idiot doctor who was just spouting his mouth off and didn't know what he was talking about. And so the average patient has tried to join the gym and join Weight Watchers. They've tried it 100 damn times. It didn't work, or it was not sustainable, right? You may have even tried some stuff like that once or twice, you know?
I've tried eating boiled white potatoes for months. I've tried a lot.
Right. And I don't know if you got that advice from a doctor, but the advice you did get from a doctor, when a doctor sat down with you and said, okay, you need to do the following things. Did you not do that?
Oh, yeah.
Yeah, but it didn't work. And so what you get is you got this burnout doctor who fully believes the patients aren't going to do what he or she says. And you've got a burnout patient sitting on the other side of the room who has tried all that stupid shit and none of it worked. And so it's literally two burned out people who don't believe a word each other says. That's the average medical office visit encounter. And that's depressing. I think that's part of the reason that substance abuse and suicide is so high in doctors, is because it's maddening. You literally had this dream as a child, and now this is the outcome of your dream. You're literally sitting here arguing with people all day who you think are not listening to you, and they did listen to you, but what you said didn't work. And so you're faced with either these people are idiots, or I'm an idiot, or we're both idiots. What kind of life is that? No matter how many zeros you're making on your income a year, that's not fun. And now being a doctor, and I still have a small practice, I see a few patients I've been seeing for years. Now it's fun because every time I see them, they're motivated, they're eager, they are doing what I said, and it did work. And it's the coolest thing ever.
Yeah. And you guys, I bring this up too, because my physician, when I moved up to Washington 3 years ago, I could tell, in that burnout mode. You know, I've done home health physical therapy for the past 5-6 years. I haven't seen patients in a while, but I actually got to the point where I was burnt out. So I understand, I think, closer than a lot of people who haven't worked in the healthcare field. But him watching my journey, he has absolutely changed so much. At first, he didn't want to do any extra blood panels. He just didn't believe it. But then after seeing this change in me, he actually asked for my advice of how he can approach patients that are overweight and how to address it with them when he feels like they're going to be kind of emotional about it. And I feel like we are very vital, important to the change, due to sometimes I think you do have to leave your doctor. You got to break up with them.
I agree.
However, I think there are the doctors that, seeing the results, seeing us put the effort in, they are willing to then put the effort in after they see we have. And so I want to bring that, because I think it's a really important thing.
Absolutely vital to address that. Yeah. And just imagine, guys, if you were Amanda's doctor, and every time you see her, she's happier, she's healthier, her numbers are better, everything's better, even the number on the scale, but that's the least of her concerns. She feels so much better. You can just see it in her persona, how she interacts with people. If every one of your patients could be that kind of patient, how cool of a dream of a career would it be at that point, right? And so I love that you are helping your doctor rediscover his dream, basically. And because he's like looking at Amanda going, well, crap. If I start recommending this to Miss Smith and Miss Jones, and they start to also have these results, that's going to make it so much more fun and more rewarding for me to see them. And before long, your doctor will start attracting patients who've seen Amanda's story, and they'll be like, Doc, I need you to do for me what you did for Amanda. And he'll probably leave out the part where Amanda did it most of it herself and actually taught him. He'll leave that out because human nature, right?
I literally need no acknowledgement. If me doing this helps him help other people, that is 100% success.
Yes. And that's why I encourage everyone who's eating keto, ketovore, carnivore, stop being shy. Stop being afraid to bring it up to your doctor, because your doctor needs to know what you're doing, because when they see you 3 months from now, 6 months from now, a year from now, and they're like, well, they think the nurse is giving them the wrong chart. They're like, no, this is the wrong chart. This can't be the same person, right? That's huge. That is a teaching moment. And when I discovered that strategy of patients teaching doctors, like Amanda's teaching her doctor right now about a proper human diet, how beautiful and powerful and sexy that is. No, doc, you don't know it all. Let me show you what the human body is capable of if you give me good advice. Absolutely. I love it. So I don't want anybody stop hiding it from your doctor. Tell them what you're doing. Teach your doctor. And if they refuse to listen, then like Amanda said, fire your doctor.
Yeah, because there are the physicians. When I was 18, I went to PCP because I was having, well, at the time, I didn't know, autoimmune issues. And I remember he laughed at me. I told him I felt like an 80-year-old trapped in an 18-year-old's body. He laughed. He did some blood work. Never went back to him. I mean, if you're going to laugh at me and tell me that I'm just being melodramatic, those are the doctors I don't think that are ever going to change, sadly.
Agreed.
I had a handful of questions. People were concerned about how do you suggest approaching the doctors when they are feeling shy or embarrassed or afraid to get kind of snapped at by them? How do you suggest approaching them and telling them that they're doing this or they're going to do this?
So there's several different strategies that you could employ. I think if it's a new doctor or if it's a doctor that you have an existing relationship with and you like that doctor, you want to keep them, I would just be honest right up front and be like, look, doc, you know all those times you told me to join Weight Watchers and join the gym, or you told me to eat less and move more? Well, you thought I didn't do that, but I did do that. I tried that multiple times and it never worked. I want to try this new thing called a ketogenic diet or a carnivore diet. And if it's keto, there's actually over 350 studies going on right now on a ketogenic diet for different chronic health diseases, right? And so if you lead with talking about the research, like I've been looking into this, did you know they're doing a research study right now about the ketogenic diet for fatty liver or the ketogenic diet for type 2 diabetes? Virta Health they literally have a 60% type 2 diabetes reversal rate with a very low carbohydrate diet. Why do you think I shouldn't try that? I've tried everything else. Nothing worked. You've got me on 6 medications right now. My A1C is worse. Why wouldn't I try that? Because it's not like I'm just saying, hey, I'm going to go on the cabbage soup diet that I read about in a truck stop bathroom, right? There's research studies about this. Why would I not want to try that? And then maybe check out some of my YouTube videos. Down in the show notes, I very often list the research studies or the website where you can find them. Why not print off a couple of those and say, look, I've really been looking at this. Here's a research study from this university. And they found, right? So it's same for mental health. Dr. Eric Westman and Georgia E. just did a study with a doctor in France about bipolar and depression and had better results than any pharmaceutical drug has ever had in the history of medicine. At a higher cure rate, a higher reversal rate, a higher discharge from inpatient psychiatric care than with any other drug in the known universe. Why would I not want to try that if I were a patient with bipolar or depression? Why would you not want me to try that? What are you saying? You just want to keep me on pills? That's weird, right? And I think if you approach it respectfully, but at the same time, have your gun loaded in case you need it with some research studies and with some examples. And say, look, there's other people in the world doing this and they're having documented success that's been published in peer-reviewed journals. Why, again, do you not want me to try it? And most doctors, unless they're just egomaniacal Hitlers, they'll say, fine, you'll get the hand. They'll be like, whatever, that's fine. I don't recommend it, but that's fine if you want to do it, right? That's permission. Not that you needed permission, but if they say that, boom, there you go. You got it. But then, like we were talking about earlier, when you go back in 3 or 6 months and your depression is so much better, you had to stop a medication, or your type 2 diabetes is so much better that you had to stop injecting insulin and stop 2 of the pills, that doctor's going to know that. They're going to have to erase those medicines from your chart. That is a teachable moment. Doctors are still educable, no matter how big of an asshole they are. You can still teach them something. And that's literally why I want you to be honest and upfront, and go prepared, but don't be dishonest about it. Just say, look, I'm going to try this, and I really want you to be my learned health partner in this journey, and we can learn together. And if that offends a doctor, red flag, you're out. Get a new doctor.
Let's see. What are your thoughts on berberine? It's something that can be, is it something that should be recommended versus taking something like metformin?
So metformin, glucophage, and berberine are effectively the same exact thing. Two of them are FDA approved. Berberine is considered a supplement, right? Now, if you buy the berberine in the bathroom of the truck stop, then it's probably, you can't really depend on that. But if you buy it from a very reputable company, then it's going to be consistent and it's going to be fine. A lot of people are just anti-pharmaceuticals, and I totally get that. And so they like, I'll take berberine, but I'm not taking metformin. Some people have disastrous gastrointestinal symptoms from taking metformin or glucophage, but the symptoms are not so bad with berberine. I think it's totally fine. And for anybody who still has an A1C above 5.6, I think that metformin, glucophage, berberine does serve a useful role until they get the A1C 5, 6 or lower.
Right. Why are diet sodas so bad for us?
Yeah, I don't know that diet sodas are so bad for us, okay? But I do know that they are made by multi-billion-dollar corporations who don't give a damn about your health. I do know that's true. I don't think that's arguable. I do know that those corporations will cut corners, and they have attorneys that they call bean counters who literally will say, okay, if we use this ingredient instead of that other ingredient, there's a little bit increased risk that it might cause this if you consume it. So what we're going to do is we're going to run a model, and we're going to say, okay, if 20 million people are drinking this, and out of that 20 million, 100,000 get sick and sue us, what's that going to cost? But how much profit are they? Literally do those kind of equations in that size company. That's worrisome to me. Does that make sense? And so I'm not willing to trust my health to somebody who does those kind of calculations, who consider it, it's fine. It's only a 1/10 of 1% chance that they'll develop liver cancer. And if only 100 of them do, and they sue us, we can pay them 20 million and we'll still make $5 billion profit. Yeah, boom, go ahead, make the change. That's number one. Number two, the artificial sweeteners are very worrisome to me. The research is very equivocal, but everybody needs to know this if they don't already know. Most of this research done on aspartame, NutraSweet, saccharin, all these were done in universities where some, if not all of the funding came from the company that makes the product. Again, human nature is what it is, and common sense should rule the day. And so if the fox is getting paid to watch the hen house, I would not be a comfortable hen, right? And so that's number two. Number three, for many, many people who have a sugar addiction or a carb addiction, just that perfect blend of bubbles and a sweetener and a little bit of flavor is enough to break them down and bring up the old cravings, and they'll go on a binge. Some people can drink Diet Coke as part of their keto or carnivore, and they lose weight like crazy. They get healthy like crazy. They do great. Some people, they have to leave the diet sodas alone, or it'll call up the cravings, and they'll be on a 2-day binge before they know it. And so I don't think they're terrible, deadly, but I do think there's a lot of things that are worrisome about them. And I think it's probably best for most people to either avoid them, or if you're currently an addict, you can use my mineral water hack to keep diluting the Diet Dr. Pepper or Diet Mountain Dew or whatever your current poison is. Just keep diluting it down until the point where you don't miss it anymore. Then just stop buying it.
How do you feel about trading the sodas out for just like flavored seltzer water without the sugar, without the artificial sugar sweeteners in it?
I think that's much less bad, and maybe much better. But I would love it if most everybody would eventually just be on a sparkling water. If you got to have the bubbles, some people don't like the bubbles, but if you need the bubbles, then San Pellegrino, Gerald Steiner, Topo Chico, Perrier, and you're still getting the fizz, but you're not getting all the other potentially worrisome things.
Yeah. I have a seltzer water 3 or 4 times a week, maybe. And it's the no sugar, no artificial sweeteners, because I'm one of those that I can't do anything sweet. Nothing sweet for me, nothing that resembles sweetness. So
yeah, if I have the sweet soda, I'll be looking in the pantry, looking for the cookies.
Yes. Should postmenopausal women increase their protein macro over their fat macro in order to prevent sarcopenia?
So in order to prevent sarcopenia, the protein requirement probably does go up as you get older. That is probably true. But I don't know that your protein macro needs to be higher than your fat macro. I think the way to say it so that people understand and that they're cognizant of it is to say that you need to be getting adequate protein. Whether you're doing high fat, adequate protein, or you're doing high protein, adequate fat, I don't think either one of those are bad strategies, but I think each one works for different people, works better. Does that make sense? But in any case, you always need to be getting adequate protein.
I know their next question is going to be, what would you consider adequate protein?
Yeah, somewhere between 1 gram of protein per kilogram of ideal body weight, all the way up to 1 gram of protein per pound of ideal body weight. Somewhere in between there, I think, is the sweet range. And then as people get older, they really need to bump that protein up a little more, or they're at higher risk of sarcopenia, which means losing enough muscle mass that your bones get weaker and that you just don't have the resilience that you did as a younger person.
Yeah. Okay. Why don't we need to eat fiber? If we don't eat it, won't we get colon cancer?
Yeah. So all the studies about fiber. So I'll just tell you the story about fiber. So there was this English doctor, his name was Burkitt, and he went to Africa to study tumors, and he didn't find many tumors. But what he did find is this particular tribe that he was staying with, they ate a very, very high fiber diet because they were stuck in a geographical location where they had no access to animal foods. And so he noticed they also didn't have any colon cancer, but they didn't have any tumors because they were still eating an ancestral diet, living in an ancestral setting. And so I don't even really know why, just said, okay, these guys don't have colon cancer because they're eating all this fiber. And he would describe the ginormous poops that these native Africans would have, right? Like they would literally look like a wild animal had pooped after they pooped because they were eating this high fiber diet. And in his mind, he was a very intelligent guy. He discovered different kinds of tumors, or some tumors named after him. But he just made the mental leap. Oh, okay. So if you eat a high fiber diet, you don't get colon cancer. And he went back to England and he wrote a paper or two, wrote a chapter in a book, and that became dogma. That's literally how it started. He was watching these Africans have ginormous poops. And then he made this unsupported mental leap. Okay, so eat lots of fiber, you won't have colon cancer. And then he came back home, and I mean, the amount of fiber he recommended eating was insane. But there has yet to be a controlled experiment in humans that proved that if you don't eat fiber, or you don't eat a specific amount of fiber, you will develop colon cancer. That study has never been done, and it never will be done. The studies that they quote are observational studies that show a possible weak association between low fiber and colon cancer, or eating higher fiber and having fewer colon cancers. These are epidemiological studies that cannot show causation. They cannot show proof. They can only show a possible association. And so when you hear your doctor say that, just say to your doctor, Doc, could you print me out a copy of the study that proves that? And that'll be a teachable moment for your doctor, because there is no such study. There is no study that proves that, and there never will be. And indeed, I know carnivores who have been carnivores for 10, 15, 20 years, and I've yet to meet a single carnivore who developed colon cancer after being a carnivore for 5 years or longer. And you would think if fiber was so valuable and red meat was so dangerous, that 5 years, that ought to be long enough, that they ought to have a big old fat pulsating colon cancer, right? But I've not yet to meet a single carnivore who said, yeah, after my 7th year of carnivore, I got colon cancer. I've yet to meet that person. And I guarantee you they would be very loud about it if that happened. They would be telling, dude, you got to eat fiber, dude. I was carnivore and I got colon cancer. I haven't met that person, haven't heard anything about them.
And if it was the case, it'd be considered causal. So every person that was not having fiber would pretty much have it.
Exactly. Yeah. And so if it's not causal, is it related to strongly enough that out of an abundance of caution, we should include it in our diet? Some carnivores do that. I don't think it's necessary at all. I haven't had a shred of fiber in 4.5 years, and I have no problems in the restroom. So I don't know of any other carnivore who does either over and above the maybe 1 or 2 week transition period when they first start carnivore. There are just no problems in the restroom and no increased incidence of colon cancer.
What would you suggest that people who do experience constipation, I'm talking like 8, 9 days not going, is there something you would suggest they take? I've experienced that twice, and it was because I wasn't drinking enough water. I didn't have any water entire day, and I wasn't having enough fat. I drink water, have fat, I'm fine. But those people who are struggling a couple times.
Yeah. And the research actually shows that drinking more water has very, very little effect on constipation or on how much fluid is in the fecal matter or how soft the fecal matter is. It all boils down basically to fat and magnesium. Those are the things. And so then first let's talk about what constipation actually is. Constipation is not just not having a bowel movement when you think you need to have one. That's not constipation. Constipation has a very specific set of symptoms. You're having rectal pain. You're not pooping, yes, but you're also, in addition to that, having rectal pain, rectal bleeding, cramping, bloating, abdominal pain, having to use a finger to help the poop come out. Those are actually the criteria for a medical diagnosis of constipation. Just not having pooped in 1 or 2 or 3 or 4 days, that doesn't get you the diagnosis. But most people like to poop every now and then. You'd like to do that just to make sure everything still works. But 8 or 9 days, that's long enough that you increased your water and your fat intake, and that fixed the problem. Yeah, and a lot of people just don't eat high enough fat to get it going.
I took some, was it magnesium glycate or
citrate probably. That's citrate, the best one.
Magnesium citrate. Yeah, that helped. And then I figured out it was the fat. I was not eating enough. And ever since then, as long as I have fat, I have no problems.
Yep. Fat makes everything in the human body work better. Many paleoanthropologists now they actually call man not meat hunters, but fat hunters. Like we literally were hunting the fat from way, way, way back. And it's not because we were gluttons, Amanda, because it's very important to optimal human health and function.
Yeah. Can carnivore help with ganglion cysts?
It might slow the growth, maybe reverse it a little, but a ganglion cyst is a kind of an anatomical defect in the synovial pouch. It might prevent them from occurring. I could see that happening. But I doubt it would make one regress and go completely away, because that's an anatomical thing. That's kind of like an abdominal hernia. No matter what diet you eat, you're going to have to get that hernia fixed. It's not going to heal.
Yeah. Scott has one, and he's going to have it fixed.
You got to get it fixed or live with it. That's your 2 choices. Ain't no diet going to make that go away.
No. Can someone do carnivore without a gallbladder?
100%. Now, you may have to come at carnivore slower. You may have to transition over 2 or 3 months. And the reason for this is that the gallbladder has 2 functions. It stores bile, but it also concentrates bile, makes it stronger. And so when you lose your gallbladder, you lose those 2 functions temporarily. Now, most people, after they lose their gallbladder, they kind of self-train themselves to eat a very low-fat diet, because if they eat a high-fat meal, they have diarrhea. And so they're like, oh, I can't eat fat anymore. That's the wrong message. What you need to do is keep eating a proper human diet with plenty of fat. What you're going to do is you're going to find that your hepatic ducts will actually dilate and get bigger, and they'll take on a storage capacity in addition to transport. And so it's like it's never I always want you to keep your gallbladder if you can, but if it's too late, if it's already gone, you can still enjoy all the benefits that come from a high-fat carnivore diet. Absolutely, but you're going to have to come at it slower. And then some people find that they have to take an ox bile supplement to kind of help. Most take that for a month or two, then they forget to renew it on Amazon, and then they find out they don't need it anymore. But I think it does help people during the transition. Not all people need it, but some people might without a gallbladder. But I know we have hundreds of people in our group with no gallbladder who are right now doing the beef, butter, bacon, and eggs challenge and are doing great with no gallbladder.
I heard some people ask does apple cider vinegar help with it?
Apple cider vinegar is one of those magical things. If you want to have a video get 1 million views, Amanda, on YouTube, just be like, apple cider vinegar is a miracle, and have some crazy thumbnail. That's 1 million views right there, because people want to believe in apple cider vinegar so strongly they cannot help it. They'll click on your video. But when you look at the actual research about apple cider vinegar, it does help a few things slightly, but it's in no way miraculous or anything. It becomes background noise in the face of a proper human diet. Now, if you're eating a shit diet, you might need to take your apple cider vinegar and some pharmaceuticals. But if you're eating a proper human diet, apple cider vinegar is probably not going to help you much past the transition phase.
Okay. Can carnivore help with Parkinson's?
Yeah, any very, very low carbohydrate diet is going to help with fructose metabolism in the brain. And so for Parkinson's, Huntington's, Alzheimer's, and all the other dementias, all the other neurodegenerative diseases, all of them, you're going to slow the progression, and maybe in some cases even reverse some of the progression by eating a proper human diet, whether that's meat heavy keto or ketovore or carnivore. You're going to notice that the symptoms are better and the progression has slowed down. Now, we don't know yet if there's a point where it's too late, right? Okay. After how many years of Parkinson's or Huntington's or Alzheimer's, is it too late for the diet to do any good? We don't know the answer to that, but I would encourage anybody, if they're willing, and this is for the family members, this doesn't mean you need to be a dictator and make your family member who you love, who has Parkinson's, eat keto or carnivore. No, this has to be their choice. They have all their rights. They get to make choices. And if they don't want to do it, it's their life. Right. But if they're amenable, and if they're like, yeah, I'll give that a try, 100%, I recommend it more over and above any other diet on the planet.
I need 30 seconds real quick. Thank you. I just didn't want them to die. I was trying to be cheap, so we bought small batteries, but they have like a 30-minute time limit.
Yep. You need to leave this in.
I was going to have them change them before they died on me.
Leave this in. Honey. This is good. This is real life. Such a good hubby.
See, how long does it take for psoriasis and other skin issues to resolve on carnivore normally?
So they may not completely resolve, but they are going to improve. And typically you'll start to see improvement within weeks to a month or two, depending on how big of a component the chronic inflammation was caused by your diet, right? Because there is a genetic component to psoriasis, no doubt. But I have personally had patients who had severe plaque psoriasis, over 80% of their body, so bad that they wouldn't even go to the grocery store. She would send her husband to get groceries. Oh, wow. It was terrible. And I finally talked her into stopping smoking, which was huge. It started getting better immediately when she stopped smoking. And then when she adopted a meat heavy keto diet, it literally went away except for a patch about this big on her calf. And she said, if this is all I got, I don't give a damn. That's fine after being covered from head to toe. it was a huge victory for her. And that's what virtually everybody with psoriasis, with eczema, with keratosis pilaris, with acne, any skin condition that's inflammatory in nature, when you remove the inflammatory foods and you lower that inappropriately high growth factor insulin back to normal, they start to get better. And I've got a YouTube video about psoriasis, one about eczema, one about all those conditions, because they all absolutely, even teenage acne, responds beautifully to a carnivore diet and gets dramatically better. And I actually had twins. I think they were 17-year-old twin girls at the office, and they had awful acne. It was almost to the point where they needed Accutane. It was terrible. And so I had the diet talk with them the first time they came. One of the twins did it, the other twin didn't. And they came back in 3 months. One twin wanted Accutane. The other twin said, I'm good. I don't need anything. Now I'll let you guess which twin adopted the meat heavy keto and which one didn't. And she did not want to talk about it either at all, because, there's some rivalry there between sisters and some competition. And she did not want to hear it. Her mom actually came out in the hall and said, don't mention the diet. Don't mention the diet, because she's going to get up and leave if you do. And her acne was still terrible. It's like, but this is human nature. People get to make their own choices. But yeah, any skin condition is going to improve when you lower the inflammation and lower the insulin.
Okay. This is kind of a two-parter. What is iodine and why do we need it?
Yeah. So iodine is an element on the periodic table of the elements. You guys all remember that from high school chemistry. You used to cheat in class. It was up on the chart. A lot of people think that iodine is just about the thyroid and nothing else. And that's what a lot of doctors believe that, but that's absolutely false. Every cell in the human body that's ever been studied, whether it's a kidney cell, a liver cell, brain cell, they all have sodium iodide symporters on the cell membrane. What's that? You say, that's a little gate that moves sodium out and pulls an iodine molecule in. That takes energy to do that. Now, the way cellular biology works is cells don't do anything that requires energy unless it benefits them. Does that make sense? Much like a person, you're not going to go out and work all day if you're not going to get something out of it. The cell's the same way. It's not going to expend ATP to get iodine inside the cell unless it needs iodine. And I've actually got a video on my channel where I've got the research of just what I talked about in the show notes. If you just Google Dr. Barry iodine, you'll find it. But there's yet to be a cell found in the human body that doesn't have a sodium iodide symporter. Anybody with any degree of understanding in biology knows immediately what that means. That means every cell in our body needs iodine, or it wouldn't have the damn symporter on the cell membrane, right? And then when you read a book like Dr. David Brownstein's book about all the things that get better, all the things that improve when you start to get a daily source of adequate iodine. At first, if you don't know about the symporter, you're like, that's got to be foolishness. That's got to be snake oil, right? There's no way it does all that. But when you realize, no, dude, every cell in the body has a symporter. It has multiple symporters, not just one. It has multiples. That means that iodine is very important for the function of that cell, of every single cell in your body. And so people doubt that. And they're like, I don't believe that. Or they'll say, oh, I've got Hashimoto's, or I've got hyperthyroidism, or I've got cancer, or I've got this, that, or the other. My doctor told me not to take iodine. Well, that's ignorant advice, because this is not just about your thyroid. This is about every cell in the body. Now, the thyroid does take up a lot of the iodine out of your circulation. That's true. But so does breast mammary tissue. And I can't tell you how many hundreds of women with fibrocystic breast disease they're like, look, I'm like, start using Lugol's iodine, 2 drops a day. And they're like, what? Iodine? Okay. And they didn't believe me. But then 6 months later, I get an email or a call, or they come back. They're like, holy shit, perfection, no pain, nothing. Yeah, and it's like magic. It's like, no, the breast tissue concentrates iodine. It doesn't do that just as a hobby. It does that because it needs the iodine. And if you're deficient in iodine, you're at higher risk of having that. Same goes for the salivary glands, multiple other glands in the body concentrate iodine. They don't do that as a hobby. They do that because they need it. And so iodine is the answer for a lot of people, for a lot of things. And that's why I've made more than one video about it, because it's so damn important. I was going to say one other thing. Oh, and then, the iodine allergy. I've got a video about that too. There is no such thing as an iodine allergy. This is a myth. If you're sitting there listening to this right now going, oh, bullshit, I do have iodine allergy. My doctor told me. No, you don't, honey. You don't have an iodine allergy. It is literally impossible. If I could reach inside your body right now, you have iodine in you right now, and pull out every atom of iodine, you would be dead within 10 minutes. You would die. You have iodine in you right now, and you are not allergic to iodine. Saying that a person is allergic to iodine is like saying a person is allergic to air or allergic to water. It's ignorant to even say such a thing. And I'm not saying you're ignorant. I'm saying the doctor that told you that is ignorant. There is no such thing as an iodine allergy. Now you'll get tons of comments. I do have, no, honey, you don't.
And I've seen a couple people make comments that they don't take the iodine orally, they put it on their skin. Can you absorb it just through your skin?
Maybe a little, but not nearly enough. Not nearly enough. Okay. So, and here's why. On your skin, you have this outer layer of dead skin cells called the stratum corneum. That's what makes us waterproof. That's why we're not amphibians like frogs. That's why if we're in the desert, we don't just dehydrate immediately. We have to, the only way water can get out of your skin is through sweat glands. It can't just come out. But that also means things can't just go in. And so really the only thing that can absorb through your skin is a petroleum product, something that you don't want absorbing. So that's why you don't get gasoline on your hands. That's why you don't get oil on your hands. Those things can actually go through the stratum corneum. Now, you might absorb a little bit of iodine through your skin, but it's never going to be enough to supply all your cells with the iodine that they need. There's no reason not to take it orally. Every morning, I'm actually off coffee now. This is peppermint tea. So in the morning when I make my peppermint tea, I'm doing a 90-day challenge. I still love coffee. But I'll put 2 drops of Lugol's 2% iodine in this because I know that every cell in my body needs that iodine. And if I get too much iodine, guess what will happen, Amanda? I'll pee it out. It's simple. Your body takes what it needs and you excrete the rest. That's how simple this is. And so everybody needs to either eat the iodine-rich foods I talk about in my video or use an iodine supplement.
I want to clarify because I've had handfuls of people ask this. Even if you do not have hypothyroidism, we still need iodine, correct?
100%. If you are a human being and you can fog a mirror with your breath, you need daily iodine. The end. There is no exception to that. Okay. That also applies to your cat and your dog. They need a good source of iodine as well because they're also mammals.
Yes.
I don't know about your goldfish or your turtle. I don't know about them.
Something that I learned is with dogs specifically, they need a higher amount of calcium, magnesium in their diet. So eating things like non-weight bearing bones with their meals, if you do carnivore with them, is like numero uno important to prevent issues with them.
Absolutely.
Can you eat too much on carnivore?
I suppose if you were at the county fair hot dog eating contest and you were trying to win the $50 prize, you could eat too much by forcing yourself to do so. But if what you're doing is you're listening to your hunger and eating when you're hungry, and you're listening to your satiety and you stop eating when you're full, then I literally don't think it's possible to eat too much of fill in the blank animal source food. I don't think you can eat too much butter. I don't think you can eat too many eggs. I don't think you can eat too much beef, too much bacon. There is no such thing as too much. When you've had enough, your satiety hormones will turn on and they'll say, that's it. Amanda, you're done, honey. Step away from the bacon. And Amanda will still love bacon, but she will be done with bacon at that moment and for a while afterwards. And then she'll be hungry for bacon again. So no, you're not going to, humans are not, your physiology is ancient and wise and brilliant. It's not an idiot. You're not just gonna be like, this bacon cake tastes good, I'm gonna eat 42 pounds. It doesn't work that way. At some point, your satiety hormones kick in and you're done.
So pretty much the only way to really overeat is by forcing yourself, or if you're eating your emotions, using the food for comfort versus actually just the satiety we get from eating.
Yep, absolutely. And what most people find is that it's much less helpful for your emotions to try to eat to your emotions on a carnivore diet. It just doesn't work nearly as well. And before long, you wind up just eating for hunger. Whereas with the snacky carbohydrate stuff, oh, honey, you can eat your emotions and you can just keep on doing it. Right.
One time, Scott and I sat down and we calculated out an old meal we would have had at like Cheesecake Factory. It was 450 carbs. I'm like, and then I counted the calories and all that. I'm like, God, to eat that much in animal fats and protein, there's no way. There's no way I could have gotten anywhere close to the amount of energy consumed that I could have in that carb meal versus a carnivore meal.
Yeah, and you'd be if you tried to do that with beef, butter, bacon, and eggs, you would be so satiated. You'd be like, if I eat one more bite, I'm gonna Ralph. I cannot. Yeah. I'm done. But you can sit there at Cheesecake Factory and you know what? Let's get another piece of cheesecake.
Mm-hmm. It's insane in the amount we can get in ourselves with the carbs and sugars compared to if you're eating meat and fats. Why am I gaining weight after 7 months on strict carnivore despite doing OMAD and having no cheats? I need to lose about 40 more pounds, but now it's 60 pounds because I've gained 20 so far.
Yeah, this person needs to go see they first need to watch my video called The 13 Reasons Why Your Weight Loss Might Stall. And then you need to go see your doctor and investigate all 13 of those reasons because something's not right. Something's went awry. It could be thyroid, could be adrenal, could be sex hormones. It could be that sauce or that rub or that condiment that you just assume was zero carb is not zero carb. There's all kinds of different things that could be causing this, but I promise you, it's not truly animal-based food causing it, and it's also not your body being an idiot. Neither one of those things are true. You may have an undiscovered diagnosis that you don't know about that's causing that. You need to watch my video and then see your doctor.
Okay. And guys, I'll have all of the links for a handful of these videos to Dr. Berry's channel in the description, so it'll be easier for you to find them as well. When did you realize the standard American diet was death, a sentence pretty much?
So all my life, teens, 20s, up to mid 30s, I was very slender. I call myself a white Ethiopian. I mean, I was skinny, bony. That's what my Granny Berry would say. And then about 35, out of med school, working in the ER, I was wearing scrubs all the time. And so scrubs have a drawstring, which doesn't really give you any feedback on how things are going. And then I tried to put my blue jeans on. I was like, what the hell has happened here? And so then I started paying attention, but I was just eating whatever, and I tried to eat healthy, whatever the hell that means, but I was still just eating whatever. And I got up to 297 pounds doing that. And this is for previously, when I graduated high school, I was same height as I am now. I weighed 185 pounds. And I got up to 297 pounds, which for me was like, and I was pre-diabetic. And I'm like, okay, so that no longer works for me. But when I was 19, I could literally live on jelly donuts and Doritos and chocolate milk and still not even have a 6-pack, have an 8-pack. I was so bony, right? But that stopped working for me about 33, 35. And then I started the American Diabetes Association diet because I was a doctor. I was not going to do any foolishness. I was going to do what was approved. And my A1C actually got worse and I gained 5 more pounds. And that's when I was like, oh, wait a minute. Because I couldn't do what I used to do to my patients, which is secretly accuse them in my mind, oh, they ain't listening to me. They didn't do what I said. I live with me. I knew what I was doing and what I wasn't doing. I even started jogging, Amanda, and I effing hate jogging. And I still gained weight. My A1C went higher. And it was at that point, that was the epiphany. I was like, something's bad wrong with nutrition. Either I slept through medical school, I missed something's not right here. SAR. And so that's when I went back to the drawing board. I read Dr. Atkins' Diet Revolution. I read the Paleo Diet. I read Primal Blueprint. And those are my first 3 books where I'm like, I got to try something else here. So this is not working for me. And it dawned on me, because I'm a common sense country boy, I wonder if it hadn't been working for my patients too. And I've been assuming that they weren't even trying. Maybe they were trying just as hard as I was, and it's just not working. And that was really the moment when I felt like a piece of crap. It's like, wow, yeah, Mr. Arrogant, you really knew it all, didn't you? Look at your fat ass. Okay. And so that was the moment when I was like, okay, so there's a problem here. And that's was my journey to rediscover a proper human diet. And we've, thousands of us around the world have been making that journey personally, either because of a joint condition or a skin condition or a gut condition, but we all wind up at the same place, don't we, Amanda? Either meat heavy or all meat. That's the solution. And that could be coincidental, but I doubt it.
I have like 5 more questions. It's been about an hour. I don't want to take up too much of your time.
Let's do 2 more.
2 more? Okay. Yep. Let me dig through here and see which ones.
Get the good ones.
Okay, here's a specific one. Someone that is bilateral crypt was bilateral crypt orchid led to hypergonadism.
Hyper or hypo?
Or help with the low testosterone from it.
Hypo. So they had bilateral crypto, and now they're very hypo testosterone.
Yes.
Yeah. So probably not going to help. Even the surgical dissension may not even help at this point. If I'm assuming they're an adult.
Yes. Yeah. They fixed the crypt orchid issue as a child, but because it was delayed, it caused the hypergonadism.
Yeah, I got you. And so what they're really worried about is the low testosterone.
Yeah.
Yeah. So if they still have functioning testicular tissue, I don't know how long it went. I don't know if they still have functional tissue. We've seen guys increase their testosterone just with a carnivore diet, anywhere from 50 points all the way up to 400 points. It documented. I've seen their labs before and after.
Okay.
The only thing that changed was their diet. So I know that can happen. Now, is it going to happen for everybody? Of course not. That's not how life is. But somewhere between 50 points and 400 points, most guys are going to be happy somewhere in there if they get that much free testosterone just by eating delicious meat. So I would 100% recommend they try carnivore, do it for 90 days, strict, high fat carnivore, and then get the testosterone rechecked. If it comes up a meaningful amount, then definitely continue carnivore. And you may not even need exogenous testosterone. But if you lost enough testicular tissue before the crypto was fixed, then you may have to do an exogenous testosterone via, BHRT or testosterone injections.
I have a kid with egg, dairy, including goat milk allergy, peanut and tree nut allergies. How can I make sure she's getting all the nutrients she needs without these food groups?
So most egg allergies are actually an egg white allergy. Many egg allergies are just an allergy to the white of improperly raised chickens that are fed improper diets. Many people find that if they find pastured eggs from a little retired couple who have 20 hens in the backyard, that they can eat those just fine. And then other people find, even if they find that little retired couple, they still can only eat the yolks. And the yolk is where the vast majority of vitamins and minerals are at. The white is almost all protein. And so you can get your protein from another source and get all the vitamins and minerals from the eggs. If you just are literally allergic to eggs, then you're going to find a liver that you enjoy. You're going to learn to like chicken liver, cod liver, calf's liver, sheep liver. You're going to learn to like liver because that's a literal multivitamin, multi-mineral superfood, right? And so then you don't need any dairy. And the only thing that people are allergic to in dairy is either the lactose or the caseins or the whey. No human on the planet I've yet to see in black and white is allergic to the fat component of dairy. And now some people are so allergic to the protein that they can't even eat butter because it still has traces of the protein. It has to be clarified butter, ghee. They can eat that. But even the butter's got too many traces of the casein still left in there. But most people with a milk allergy can eat butter or ghee just fine. Okay, so you got your butter. You hopefully can eat egg yolks from pastured hens. If not, learn to like liver and then eat all the meats, and you're going to be fine.
Okay, awesome. Thank you so much for taking the time to answer all of these questions. I truly appreciate it. I love watching you and Nisha on Mondays. Usually I'll eat my dinner and watch you guys.
Nice. Nice. I love it. Well, it's been a pleasure chatting with you, Amanda. I can't wait to see what's up the road for you guys. It's nothing but exciting and nothing but uplifting and motivating to watch you and to see you on Twitter correcting incorrect opinions. I love that. I want you to keep doing that. You're beautiful and I love what you're doing. Do not ever stop.
Thank you so much. And I will be so excited to see and meet you guys in person, Scott and I, on the cruise in June too.
Lowcarbcruise.com. I love it. I'll see you there.
All right. Thanks, Dr. B.
My pleasure, lady.
Bye.
Bye.